Hello, welcome back. The topic today is about dry cough. A cough without production of phlegm or sputum is called dry cough. Usually cough, I always say it's like a protective mechanism, like sneezing, cough, vomiting, diarrhea. These are all like protective mechanism. Suppose the dust goes in, we sneeze. And if you have phlegm or sputum in the color or anything in the lung, you want to bring it out, so we cough. The same way, suppose you have some stale food or infected food, you vomit, it protects you. The same way, suppose there are some food poison happens, you have a diarrhea. So these are all not diseases, it's only a symptom of some other disease, and it literally protects us. So that is why, without knowing, we should not suppress all these symptoms. So coming back to cough usually there are two types. One is protective cough, where you have a sputum or phlegm, mostly because of infection, mainly the respiratory tract infections. This is a very common one. What is a dry cough? People most of the time, they'll be suffering from a long period of dry cough. So again, the dry cough, the commonest reason is any viral upper respiratory tract infection, where you have a laryngitis, upper aerodigestive infection by a virus, SARS virus, coronavirus, or any flu virus, anything that affects the upper respiratory tract. So the soreness of the upper respiratory tract causes dry cough. Usually that settles down after a week's time, or even after a couple of weeks. Usually that subsides after the infection is gone, or after taking some medications. The second reason for the dry cough is anything in the lower chest infection, respiratory tract infections, including asthma. They may have a dry cough. So what we are really concerned is stomach part has a role in dry cough. Yes. Suppose a person has a ulcer, acidity, or a acid reflux, the acid and bile, they come up to this level, and they can irritate. They can make the larynx sore. The acid literally corrodes the larynx. So some amount of irritation will be there that causes repeated cough, dry cough. Most of the people go to the pulmonologist thinking that it's a respiratory tract infection, and they may be given an antibiotic or other medications, and usually they won't help it. In fact, they will aggravate the problem. So usually GERD, most of the people know GERD, gastroesophageal reflux disease. So where the foot pipe stomach junction, the sphincter is very loose. So the food, acid, bile in the stomach, instead of going down, they come up. So they may have an acidity problem, stomach pain, or heartburn with cough. Most of the time, the stomach pain or the problem or even the heartburn may not be there. They may have only dry cough. How to know it's all because of the gastroesophageal problem, the dry cough? Most of the time, the cough happens after the food, especially full, stomach full meal, or spicy food, oily food, cheese, mayonnaise, all these things. When they have food, these dry cough happens, and especially in the night time after food, the cough is so severe. And if you're going to lie down immediately after taking food, again the cough increases because the gravity is gone, so everything comes up, they'll have a cough. And not only the spicy, oily food, even sweet, most of the time can aggravate the cough, irritates the upper aerodigestive tract and cause dry cough. Sometimes the cough will be very incessant, even they can cripple the patient. That kind of cough can happen repeatedly. Most of the time, these stomach problem leading to dry cough people will be around, obese, central obesity. They may be taking some medications that can irritate the stomach, or they may have a gallstone. So these are the people, especially after taking food, that dry cough happens. It could be because of stomach related problem. And any food that has a citric acid, like your orange, grapes, mango, they can aggravate the cough. Even people who take spicy tea, ginger tea, they can irritate. Tea, any tea also can, even milk. Milk goes in, acid and milk becomes, comes up, can irritate. So tea, coffee, milk can aggravate the dry cough. Ginger, all this spicy, cardamom, all these things can aggravate the cough. So other reasons for the dry cough is sleep apnea. People with sleep apnea, they wake up, they have a dry mouth, they keep on coughing, so they want to clear the throat, so they can be habituated to have a dry cough kind of thing. So how to approach people with a dry cough if we suspect it's all because of the gastroesophageal disease. So first and foremost, with the history and everything, the doctor will come to a conclusion this could be the probable reason. They will exclude because of the medicine, because of the disease, acidity, infection, all these things, and they may ask for an endoscopy. Endoscopy will show the the soreness or irritation, all these things can be seen. Even the lower esophageal sphincter, the hyperthermia, GERD, distal esophagitis, these are all the signs that shows the dry cough because of the acid reflux or the stomach related problem. These can be easily identified. So how to prevent dry cough if the reason is your stomach and esophagus? So first and foremost, we always say don't eat for the full stomach. Number one, avoid spicy food, oily food, cheese, mayonnaise, all this has to be cut down. No alcohol, and very importantly, medicine that can affect your stomach has to be avoided, or the doctor has to give an alternate medicine or something has to be taken to suppress the effect of the drug. And avoid citrus fruits, mango, grapes, oranges, and sweets to be avoided. And late night full meal, the night time, have as little as possible of food. Keep a simple diet, as little as possible, and preferably a steam cooked food. Don't lie down immediately after taking food. Minimum at least 2.5 to 3 hours, gap should be there between the nighttime food and lying flat. And very importantly, I always say avoid certain, fruits like watermelon. Watermelon is good for the stomach, but it regurgitates, aggravating the cough. Cucumber, also good for the stomach, but bad for the reflux. You can avoid cucumber. And beyond these things, if you have these problems, probably don't keep the upper aerodigestive tract, this area, dry. Keep sipping mild water, small amounts of quantities of water. Keep it wet, preferably plain water or even warm water. And probably you may need to take PPI, proton pump inhibitors like omeprazole, pantoprazole, or even to tighten the lower esophageal sphincter, you may need domperidone, domestol kind of medications, or even antacid. Antacid is the best way, I always say, the best way to stop your dry cough is antacids. So because they can coat, they can make that area smooth, they can even sometimes with the local anesthesia they can make it numb so that the cough will subside. In fact, I say when you take antacid, take the antacid, you can gargle it, maybe 10 ml, 20 ml of antacid, gargle it, keep the the antacid here for some time, then swallow. Definitely at least 50 to 70% reduction in cough, dry cough may be there. And if very rarely, if the irritation is so severe and the cough is so it affects the day-to-day life activities kind of thing, then probably the doctors may sometimes prescribe steroids to suppress or to heal this area, to suppress the thing. So endoscopy can rule out, and ultrasound will rule out the gallbladder stones. So dry cough could be because of stomach issues, and if it is so, see your doctor, get yourself examined, probably do an endoscopy. Most of the time, the dry cough, if it is because of the stomach, usually obese people with acid reflux, gallstone, dry throat, heartburn, spicy food aggravates the problem, citrus fruits can aggravate the problem, sweets causes dry cough, and especially it happens in the night time. then it could be because of your upper aerodigestive tract problem. See your doctor and get yourself, get the relief. Thank you.